I'm Holly Kennedy, and I'm the lead author on what we like to call Paper 5. And as Mary said, all of us gathered together 2 summers ago for a very long week in Barcelona. We didn't see Barcelona. and worked on these papers. And after several false starts, my colleagues and I finally said, all right, we're going to wait until we have the data gathered. And as you've heard today, the 4 papers that have been presented, and also with Sue's and her colleagues' paper, we have an extensive data collection of information about what we know, what the current state of affairs about midwifery and midwives are. So now, where do we go? So setting research priorities is a really important goal in this process because research takes time, it costs money, and there are limited resources. So we can neither waste time nor money in this process, and it's critical for us to focus our efforts in order to capture funders' attentions and to harness those limited resources to provide the best research to have the most maximum impact on maternal and newborn care. Our purpose is to identify the top 10 research priorities from the series to improve maternal and newborn health using the framework that you've seen so far presented. We're going to use a modified CHNRI approach, which is used by the World Health Organization quite a bit. It stands for Child Health and Nutrition Research Initiative. And the process will be conducted by the series authors, the collaborators from the World Health Organization, and various stakeholders, which I'll describe briefly for you. So in that process, the first thing you do is establish a working group, which clearly we've already done. The second thing is that it's important to understand that priority setting doesn't happen in the abstract. It happens in the real world and in the complexities of the real world. And this framework that has been presented shows you just how complex the practice of midwifery is. So that is our framework against which we will identify the research questions and the research gaps. Then the second thing that you have to do is you have to take that process, and as we go back through our database of these 5 papers, and identify those research gaps and questions, is then we have to score them based on, and these are the 5 major criteria that we'll be using. Is the research answerable? Is it ethical? As you know, doing research on pregnant women has some difficulties. Will it be efficacious in developing a new program or interventions that are going to really have a maximal impact? Is it deliverable? Is it acceptable in different cultures? Is there a maximum potential for disease burden reduction? And finally, does it have an effect on equity? Will it reach the most vulnerable groups, as I think Sue's paper is really going to demonstrate very much. So that represents the context of what our approach is about. Then the final process is taking those research prioritization scores, synthesizing them, and then disseminating those findings. We will be bringing, so we hope to have this done by early in the year, and then we will bring all the stakeholders together. The stakeholders include, and I think this is a really important aspect, not only researchers and clinicians, but policymakers and, most important, women into this process about what is important to them in prioritizing what research goes forward. Then we will bring all these folks together into in a conference type format where the funders and the stakeholders work together to actually start moving the agenda forward. So in the end, I want to return back to what this whole process is about, which is to improve the health of mothers and babies in all contexts across the globe. One of the comments, I think, from the Netherlands earlier this morning was about this focus on the newborn, and I would just like to say I think that is changing. I think this series is going to help change that. And I would say in the United States, in our Maternal Child Health Bureau, we have a new lead of that bureau who really looks at life context as the framework for health, very similar to I think what we're doing. And he said his goal is to get the M back into MCH. So I think that is where we're going with this process. So thank you.